In case of elbow pain, I ask the patient if there was an accident or if the pain suddenly happens. And for me, it's very important to know where exactly the pain is. Is it more on the lateral side? Is it more on the medial side? Is it more in the front or more in the back? Depending on where the patient has his pain and depending on the history of pain, we can have some ideas of what might happening during the injury. For example, on the lateral side, we have the epicondylus radialis here, where the extensors have their origin. If there's kind of tendinitis of the extensor, the patient will have pain exactly at the epicondylus radialis. If there's more a flexor problem, the patient might have pain here in the epicondylus ulnaris. Or in case of biceps tendinitis, the patient has pain while lifting some weights and has pain in the anterior part of the joint. For example, we see here the biceps muscle, down here is the biceps tendon, and if the patient now flexes against my hand, we can very good have a good idea where the biceps tendon is, and now we can go with the finger underneath the tendon. This is called the so-called hook sign, and now we see that the biceps tendon is still in place and no rupture is present. In case of just tendinitis, he will feel pain while pushing at it. In case of epicondylus radialis, the patient will not only have pain at the epicondylus, he will also have pain while during an extension in the wrist against weight. So, okay. Now the patient will feel pain at the epicondylus radialis because the extensor is pulling at the tendinitis origin. This test is called the Cozen test. You can also do something like the Maudsley test, which is extension of the third finger against weight, and patient might have pain also at the origin. What is very important while looking at the elbow in patients with epicondylus radialis is to check that there's no signs of instability, for example posterolateral instability. For that we can do the Pincer move. So we take our both thumbs, one is placed underneath or behind the radial head, the other one behind the capitulum, and now we move with our left hand, we do a dorsal and a supination move like that. And you can see the thumbs are moving, but just a little bit. In case of postural instability, we will have a much higher range of motion and the patient might have pain during the test.